is my remote. There. My name is Laurin Bellg. I'm a critical care specialist. I am just up the road in Appleton, Wisconsin, and I feel a little bit at home because I did some of my training in this area. I used to live at the corner of Elmwood and Dempster when I did my critical care fellowship at Rush, downtown Chicago. So this place has a special significance to me, and it's good to be back. So I am a critical care specialist. In the industry, we are known as intensivist, but that sounds too much like a personality trait. I don't necessarily want to be associated with, so I usually say I'm a critical care specialist. And this is my home. Look at that. All that stuff. And we have more. We have all kinds of gadgets and machines and medication and technology, everything you can imagine to keep you on this planet. And we're trained to do that. We are body mechanics. We are trained to keep you here. And many times we succeed. Sometimes we don't. Sometimes we succeed and then don't succeed and then succeed again. And the person that we succeeded again with sometimes will come back and tell us a great story of something they experienced when we didn't succeed. But what's interesting is that many people who come back, and if we ask them, which many times we do in the environment where I work, if they experienced anything unusual, they seem a little miffed that we were successful. They consider it a lack of success that they're actually back. So I hope to share some of those stories with you and a little bit about my own story of how I became interested in near-death experiences. Because where I am now and the worldview that I have come to embrace is certainly not where I started. So 20 years ago, a patient under my care died because I failed to recognize an out-of-body experience for what it was. His name was Samuel. I was a fresh medical graduate, so I thought that I knew a lot. Turns out I didn't. It takes you 2 months to realize that 2 weeks actually, to realize you know nothing. But I was in my very first month as a medical intern. I was an internal medicine resident, and if anyone knows anything about medical training, you know you're kind of thrown in. And there's a hierarchy. And when you are the intern, when you are fresh out of medical school, you do a lot of the admissions and the note-taking and the note-writing and the dictating, all the things that are just not fun. Those are the things that we do. And I was on a team of doctors that was part of the university system. And we had a man named Samuel that we got a call from the emergency room that Samuel was back. We had taken care of Samuel many times. Samuel would come in with abdominal pain, and usually it was a flare of his pancreatitis. And Samuel knew his pancreatitis really well. He knew his symptoms. And he knew that if he just kind of laid low, didn't eat anything, kept himself hydrated, that usually in a few days the nausea and the abdominal pain would get better, and many times he didn't come in. Sometimes if he couldn't control it, he would come into the emergency room, we would hook up an IV, just to keep him hydrated, and treat his pain until the symptoms went away. So I'm admitting Samuel. It's my first time to meet him, and I'm taking my time talking to him because we already have him hydrated, and I'm just taking my time getting the history and trying to understand his story and what's going on. And every now and then he would sit up straight. This pain was just unmanageable. And he would kind of try to right himself a little bit, and then he would lay back down, breathe through it, and we would continue the interview. So over the course of the day, his pain got worse, not better. And so we obtained a CAT scan to try to get an idea to see if something else was going on. And the CAT scan showed that his bowel had been looped and twisted. And he had had surgery sometime before. He was a veteran. He had been in a mid-century war and had had abdominal surgery and had a lot of scar tissue. So we knew now that what we were dealing with was gut that had its blood flow cut off. Ischemic bowel is what we call that. And it's kind of like a heart attack when you block those vessels and you don't get vital blood to the heart muscle. The same thing can happen in the belly. If you twist off or block those vessels, you get a gut attack. You get dying gut. And so that was what was going on with him. And that's what the CAT scan showed. And so I came back to talk to Samuel, who was my patient, fully my patient at this point in time. And I said, Samuel, we know what's going on now. It's not your typical pancreatitis like we thought it was. You have some dead bowel in there. The circulation is cut off to your gut. We need to take you to surgery. We can fix this. And he said, oh no, I'm not doing that again. The last time I had surgery, I saw the whole thing. And I'm not doing that again. It scared me to death. I didn't know how to respond to that. Because when you are in any kind of intense training for any profession in this human race, you spend a lot of time in the left brain world. And that's the language that I spoke. I spoke a very concrete language of physical matter reality. So in my mind, I feel really bad for Samuel. Because in my mind, anesthesia didn't work, and he had suffered something horrible. He observed his surgery, felt the whole thing. And if anybody's ever been into a surgery room, you know that there is a sterile drape that comes up from the body that's been prepared for surgery, and it is kind of hooked into a partition that has the head on one side and the rest of the body on the other. And so there's no way that you can see your surgery. But I'm still trying to sort it all out. I'm still trying to fit the pieces of the puzzle together. And I said, well, did you feel any pain? Because that was my primary concern. He said, no, I didn't feel pain, but I could see everything. I saw them cut my belly open. I saw them spread it apart. I saw them lay my guts out. I saw them piece it all together. I saw them dig shrapnel out of me, and I will never do that again. There was no talking to him to try to convince him that this was a safe procedure. I didn't even know what to say to him. I didn't know how to help him understand his experience because I had no idea what that experience was. But my thought was that perhaps there was something that I just didn't learn in medical school. Maybe it was kind of a fugue state or some kind of psychiatric phenomenon that allowed him to have this perception that maybe he had seen his surgery. I was really working hard to try to make this make sense in my language. So I went to my resident, the intern, I'm down here, my resident's the next most knowledgeable person on the team, and I said, Samuel refuses to have surgery because he said he saw his surgery 10 years ago and doesn't want to have it again. And he looked at me, kind of like I had looked at Samuel, trying to process what I was saying, and he said, whatever you say on rounds tomorrow to our attending physician, I wouldn't say that. And even though I didn't know exactly what was going on at the time, that was my first indication that it's not safe in medicine to talk about anomalous experiences that we can't reproduce in a scientific lab. So what I ended up doing was going down to the bowels of the hospital to medical records. And my thought was, if I can just get to his chart and trace that surgery back and find the record of it, maybe I can get a clue as to what happened, because it was bothering me. And I was very uncomfortable, because I felt that fundamentally my medical science had failed him. And he had experienced pain that was still so post-traumatic several years later. So I found the record of his surgery. And what I was looking for was the anesthesiologist's report, because it's the anesthesiologist's job to record minute-to-minute heart rate, blood pressure, level of consciousness, anything that is happening to that physical body at the head of the bed is recorded. And I knew that if Samuel had had any suggestion of a level of consciousness, the anesthesiologist would have remarked on it, would have increased the anesthesia, something would have happened to make sure that he was deep enough not to feel pain. Heart rate, blood pressure would have been elevated. None of that happened. I didn't see any of that. The surgical record was boring, as it should be. There was nothing to explain to me what had happened to Samuel. Samuel refused surgery. He had the support of his family. We made him comfortable for his wishes. He continued to fail and passed away. That bothered me. That bothered me because I knew there was a life-saving surgery that would have saved him. But because I didn't understand it, I couldn't explain it to him and say to him, I know that was frightening, but what you experienced, what you probably experienced, was an out-of-body experience where you could actually, from a higher vantage point, see what was going on, and it's not dangerous. And guess what? It's happened to other people too. You're not the only one. But I didn't know that at the time. But that was a pivotal moment for me, where from that moment on, I was paying attention. I didn't know enough. I didn't know about out-of-body experiences. I didn't know about near-death experiences. I'd been busy. I didn't have the time or even at that moment, the level of interest to pursue that, but that changed in that moment. 1997. I was very quickly back into medical training though, so my opportunities were limited as far as paying attention. But every now and then someone would say something interesting and it would catch my attention and I would ask a little bit more and that would deepen my interest. But when I started working in Wisconsin, in Appleton, Wisconsin, where I still work, I finished my training here 16 years ago, went up to the Fox Valley, and that's where I've been ever since. So I've been in the same hospital system for 16 years. There was another event that happened so many years after Samuel in the early 2000s that brought me right back and informed me that maybe this is something that's a part of my work. So one of the hospitals that I work in, one of the intensive care units where I work, is a trauma intensive care unit. Now you can imagine that in a trauma ICU, there are lots of opportunities to find people at that fragile edge who've experienced something and have the interest to tell us. This is what happened when I met Kyle. So in the upper Midwest, we all know we have lots of bodies of water left over from glacial melt. Big lakes, winding rivers, lots of opportunity for outdoor recreation. And Kyle had been parasailing on the Wolf River behind his friend's boat in this big outstretch of the Wolf River where there was lots of opportunity to make lazy arcs with your boat and kind of catch the wind. And well, there are two versions to this story. Our version and Kyle's version. And in our version, based on witnesses, his buddy was driving the boat and Kyle caught some wind and was blown into some utility wires. Wasn't well harnessed into his parasail, fell out and hit the water with great force, lost wind, lost heartbeat, began to drown. And there were two ladies on a boat nearby who motored over, pulled him out, and pulled him up onto the boat and resuscitated him, called emergency workers. Now Kyle's version, and you know, to Kyle's good fortune, one of these ladies was an emergency room nurse. So she had lucky Kyle. But it gets better. Kyle gets even more good luck in his story. So in Kyle's version, I was having a good time, catching some wind, looked down below, saw these two babes that were just hanging out on the boat. And I got distracted. And I drifted up, and next thing I know, I see this guy falling, and he's heading toward the water, and I thought, oh, this is not going to be good. And so I saw him hit the water, and next thing I know, I'm on the hull of this boat, staring up into the faces of these two babes. And I can only imagine that at this point, Kyle heard celestial music of the Sports Illustrated type. But the ladies that he was flirting with became his rescuers. But that was not the exciting part for Kyle. The exciting part was that he realized at some point, hey, that guy that I see falling is me, and I'm watching myself hit the water and drown. And that was life-changing for him. And he was a young guy, I mean, 28, 29, and he would tell anybody who would listen. Nurses, doctors, respiratory therapists, anybody who walked, housekeeping, anybody who walked in. He was excited. This was life-changing for him. And as is frequently the case in an intensive care unit, I don't have follow-up, so I have no idea what happened to Kyle. But from the time that he was able to talk to the time he left the hospital, he was talking nonstop about this experience. So I have to believe that it had a positive impact on him. Because he said, and he was kind of a funny guy. He said, I'm not afraid to die, especially if it means falling into two beautiful women. So, he joked about it, but at the same time, it was clear that this had been a pivotal moment for him, where he thought about life differently. He was transformed by it. He was impacted positively by it. And I was impacted. I was interested. I was hooked. Because whatever happened to him, I wondered if it happened to other people. And I reflected back on Samuel, who I'd actually never forgotten, and something started to click. And I thought, is this a spectrum of consciousness that we all have access to, that during times of trauma and near death and extreme duress, that our consciousness actually is able to hold ourselves at a protective distance? Is it something that is completely natural, that we just don't have the science to understand? Is it a spectrum of consciousness? Is it spiritual? Is it all of the above? Those were the questions that I had for myself at that time after I met Kyle. So I came up with a plan. I thought, I am going to ask. If anybody dies, I'll be respectful and give them time to recover, but at some point, I want to ask them, when you died, did anything unusual happen? When you had your car accident, and it took us like 2 hours to get you out of the car, did anything unusual happen? And it struck me as a question that if I asked the question, it wouldn't seem strange to them. And that's what I was going for, because I didn't want them to shut down. I wanted it to feel safe. And I thought, if nothing unusual happened, they would just say no. And that's usually what happened. Is they would say, I have no idea what you're talking about. No, nothing unusual happened. I died. That was unusual. Is that not enough for you? But my hope was that it would kind of open the door and let them know that I was interested and that I wasn't going to judge them. So the first time I asked that question was to a lady named Cora, who had come into the emergency room in full cardiac arrest. She had gone down at home, her family called 911, they resuscitated her all the way there, they worked on her in the ER, and they finally stabilized her, got her to the intensive care unit, and when I became involved in her care, over a matter of a couple of days, we were able to get her off the ventilator, and I was able to talk to her. And I said, Cora, when you died and came back, did anything unusual happen? And she said, no, and I was so disappointed. So it turns out that Cora had a pretty keen interest in spiritual matters. She had read a lot about out-of-body experiences. She had read a lot about near-death experiences. She was a very spiritual person on a very distinct journey. And she and I talked about it, we laughed about it for a while, and she truly was a little disappointed that she hadn't had anything unusual happen. Such as visiting with deceased relatives, spiritual beings, some of the classic things that we hear about. But she and I had a really nice conversation, and both of us came to the conclusion that maybe she didn't need the experience. Her level of enlightenment and interest and her trajectory as a human being was such that would she have gained anything from that experience other than the thrill of having had the experience? And she said, you know what, I don't think I needed it. And that was really a nice insight and a nice moment for me to be able to have that conversation with her because, at this point, that became a useful tool for me as I talked to patients. time I asked that question, it was another lady who had had a cardiac arrest. She went down, transported to the ER, several rounds of CPR in the ER, went to the cardiac catheterization lab, had her stent placed, had that artery open so that her heart could get the fluid and the blood supply and oxygen it needed. And then she came to us, and eventually we were able to get her off the ventilator and talk to her. And I asked her name was Diane, and I said, Diane, when you had your cardiac arrest, when you died, when we had to bring you back and resuscitate you, did anything unusual happen? And her face crumpled, and she started crying. And it took her a while to be able to share her story. And it turns out that Diane, some years ago, had had a really bad accident and had suffered neurological trauma. She had had a head injury. And her recuperation from that injury was very slow. But what was interesting is that she had some unusual abilities after she got bumped on the noggin. She had some ability to intuit. Some would call her psychic. Some would say that she was prophetic. But her family wasn't having any of it. They were very threatened by that. And whenever she would say, hey, I don't want you to get in the car because this is going to happen, and then it would happen, they would be mad at her. And so she shut down. And her ability didn't stop, but her ability to share it and to offer that gift to others went on the back burner because it had not been a pleasant experience. The people around her who should have loved and supported her didn't. And so when she had her near-death experience, and you know, during these multiple cardiac arrests, what was interesting is that she was able to explain it all to us. She was able to feed back what had happened from an aerial view. I mean, she was able to tell what it was like to be in the ER, seeing people pop up and down on her chest and shock her. But at the same time, there was this other view, so it seemed like a hybrid between an out-of-body experience and a near-death experience, where at various moments she would have communication from these luminous beings. And they never really said anything to her, but they were reassuring, and she had knowledge communicated to her that, you know, this is not an end game here. You still have some more years before you actually die. She was able to describe the cardiac catheterization. She was able to describe all these technical things that had happened to her when we knew her to be unconscious, that she was able to come back and tell us. And she's telling me this through tears, and I'm asking more questions like, well, what was it like when you left your body and you were able to see it? What did that do? Was it scary? Was that reassuring? And so we had this long conversation about what had actually happened to her. And at the end of it, she said, thank you for listening, because I can't tell my family. And so that was another moment for me to realize that asking the question, the unusual question, as I've come to call it, is good patient care. That it's not about getting an exciting story. It's not about collecting, you know, these cases. It's good patient care. To acknowledge that something unusual that you don't have a scientific explanation for happened. So she needed the question. She didn't need the experience. She needed the question. And to be able to ask her that and help her sort through some tools on how to seek her own support. And I had no idea, you know, who could support her in the community. But, you know, in being able to talk to her, she left the hospital with the idea that if my family's not going to give me support in my experience, I'm going to seek it elsewhere. I can still love them and meet my needs too. And so I felt like that was a moment of being more than a body mechanic, you know? That, I mean, that's what we do. We're body mechanics. And to be able to go beyond that and to meet a need that's not a physical need is incredibly satisfying, very enriching. You know, I found the more that I asked the question, though, I began to wonder if maybe the energy of that question started following me around, because I noticed that people would start to spontaneously tell me about their near-death experiences. And the first time that happened was a patient named Henry. And Henry had very bad lungs. I mean, he was in-stage emphysema, and he had come into the hospital after trying to make a phone call at home and not having enough wind to do it. But whoever was on the other end could tell, and actually I believe that it was his son, could tell that he was in trouble, and he came over. And in the ensuing minutes that it took him, maybe 10, 20 minutes for him to get there, he opened the door and his dad was unresponsive, not breathing. He called 911, got instructions for CPR on the phone, and is kind of keeping him going until the paramedics got there. They put a tube in his throat, and then the big plastic bubble that you would inflate to push air in that you sometimes see on TV. We actually do really use that. Not in the way that they do on TV always, but we know that's not real. But he got to a point that we could get him off the ventilator, and I was coming in to see him for my daily rounds. And if you've been in, I think most ICUs are designed much the same, where they have these clear glass sliding doors so that you can see what's going on with the patient, but there can be a measure of privacy as well. And so I stepped in, shut the doors behind me, and he immediately said, "I saw my brother." And my thought was, I turned around because I thought, well, maybe he saw his brother walk past, and we have open visitor hours, so around the clock, so that didn't surprise me. But he saw what I did, and he said, "No, you don't understand. I died, and I saw my brother." And turns out, and then he started crying, and he's telling me this story of his brother who had died some years earlier. He was so close to him, and it had been a source of great emotional pain and grief for him to be without his brother who had preceded him in death. And so for him to meet his brother, and this was interesting, he said it was so real. I mean, that's what you hear. Whenever my colleagues say it was probably a dream or a hallucination, I'm like, how many times, come on, how many times do you hear a delirious patient say that was so real and able to recount details? Usually they don't remember that they were delirious. And dreams, sure, but the amount of detail and the clarity with which patients have these experiences is remarkable. And if you take time to listen to what they're describing, it's not like any dream or any hallucination or any delirious episode that you've ever seen in your career. It's very distinct. And that was what Henry had experienced. And what was remarkable to him is that he had a relationship with his brother where his brother was kind of like a coach, like knock it off, get back in the game. And so he had been feeling kind of bad for himself, just kind of feeling sorry for his lack of being able to breathe. And that's tough. I mean, end-stage emphysema sucks. I mean, it's just miserable. To breathe is primal. And to have difficulty with every breath, even when you're eating, you get short of breath, it's hard to live like that. And so Henry had been feeling kind of fatal, not wanting to be here anymore. And that was what happened to Henry whenever he died, is his brother said, "Knock it off, get back in the game, it's not your time." And he said that to hug him was so real. He said it was physical. I could feel it. I could touch it. But that moment was life-changing for him. And he said, I guess I just need to stop whining. That's the message I got. And he said, I guess it means that my time's not here, so I just need to get busy and figure out why I'm here. Which seems to be kind of a common theme for people who have had these experiences. It takes away fear of death, but many people not only have a sense of altruism, but a sense of purpose. Like there's something that I have to do. And that's what happened to Henry as well. Another thing that happened too was this Chester, okay. Chester was really not unlike Kyle, in that when something happened to him, he wanted to tell everybody about it. So Chester had a lot of heart attacks preceding his admission to our unit, and he continued to have a lot of terrible heart rhythm problems and just trouble staying in a normal rhythm. So he would have cardiac arrest several times, and we'd have to shock him and do CPR, and that probably happened 4 times in our intensive care unit. And once he was stable and he was able to tell us what had happened to him, it was really quite astonishing. he said that he would get out of his body, walk around, kind of boring, laying in bed, and then he would see a nurse coming and say, well, I guess I better get back in bed. It took him a while to realize that, body in bed, spirit not so much. Took him a while to kind of make that association, but then he was talking in terms, he laid out this whole technicolor experience of how he was so loosely tied to his body that it became fascinating for him. And he would, take walks. And then, to hear Chester talk about that made me wonder, how many other people are taking walks. But, I imagine that in that state of being semi-suspended with our medications, maybe many people do and they don't remember. I don't know. I don't know the answer to that, but it made me wonder. But also, Chester noted that he had this incredible connection to people that he loved whenever he was in this state. And he described an event where his wife and daughter and grandson were out in a waiting room, and he described their conversation. He could hear their conversation. They were looking at a sale paper, the women were looking at planning a shopping trip, and were looking at the sale paper, and the grandson was playing on the floor with this toy that his daughter had gotten for her son in the gift shop. It's a toy he'd never seen before, but he was able to describe it. And outside of the waiting room is a very unusual tree. It's like a sumac, those trees we have around, the bushes we have around here that turn red in the fall. So it was that kind of tree, of a sumac, but a big one that had been heavily wooded and quite old. And so he was able to describe that tree. But the thing is that you can't see it from anywhere except in that waiting room, because it's a courtyard. So that was very interesting to Chester. It was interesting to his family. It was interesting to us. And everybody was in a state of, tell me more. What else did you see? What else can you do? Because he also was able to kind of pick up on thoughts of people around him too, which, that, I don't know, I thought, I've got to be careful what I think. But he was lovely. It was really interesting. And what was neat about Chester is that it was transformational for him, not only for him, but his family too. His wife was excited, his daughter was excited, and I couldn't help but think about Diane and the loneliness she experienced in her family from not being able to tell about her experience and to share something so deeply personal with the people you love and get their support. So Chester's experience, being the polar opposite of being able not only have that support, but they went on a journey together, which I think is just fabulous. I have strict instructions to let you break at 3 for a feeding and a watering. So I'll tell you another quick story, and then we'll take a break, and then we'll come back. It's interesting when we have patients who have near-death experiences, and they tell us, and we as medical professionals don't believe them. That's sad, but it happens. But what's very interesting is that when a patient is telling us something that we think that couldn't possibly have happened, and they are convinced that it did. So a classic example, Thomas, in our trauma center, he is broken, hooked up, lifted, suspended. There's no way he can turn over, let alone get out of bed. Except Thomas did get out of bed, or so he thought. And he was trying to call the nurse, and the nurse wasn't listening to him. He had a tube in his mouth, so there's no way he could have called the nurse. So in Thomas's view, whenever we got him off the ventilator and he was able to communicate and share how disgruntled he was, he said, I tried to call the nurse and they wouldn't listen to me. So I thought, I will make her listen to me. I will get out of bed and I will go get her attention. So in his mind, he gets out of bed and goes and tries to talk to the nurse, and she's still not talking to him. And he said, I'm just going to stand there and see how long it takes this lousy nurse to notice me. And so he stood at the nurse's station, in his view, in his memory. He described things that he wouldn't have been able to see from his room, such as the blanket warmer and the medicine cabinet, all these things that he couldn't have possibly seen. And so the nurse said, I don't think that was a physical experience that you had there, Thomas. I think that might have been something else. And so she told me about it because she knew that I was really interested. And so we're talking to Thomas and trying to explain to him, like, you know, you were in this bed with that leg broken and held up in the air, and this is where you were. And he still hadn't left that room, but he still described areas that he couldn't possibly see. And he looked at us like we were crazy. And so the nurse and I were saying, you know, it happens. You know, some people have out-of-body experiences when they're in trauma or under the influence of medication. It happens. So there's nothing wrong with you. I know there's nothing wrong with me, he said. There's something wrong with you people that you don't come when I call you. But he could not make that leap. He could not make that connection that what had happened to him was a non-physical experience. Did not compute. His scaffolding about physical matter reality was so firm that he kept trying to push what happened to him into that frame of reference. Another instance of this that really I thought was just interesting, and they seem to be, I would too. I would be upset too if I felt like I was being ignored when I needed something. Carol needed to go to the bathroom. And she is trying to get the nurse's attention to tell her that she needs to go to the bathroom. And mind you, we're hearing this as she's telling us the story. And the day that it happened, based on who she describes and the nurse that she describes, had to be 2 days prior to us taking her off the ventilator. And 2 days before she was even conscious, so that she could talk to us. But she said, you know, I tried to tell the nurse I had to go to the bathroom, and she just ignored me. And she turned around and started listening to my heart, and she was this close to my face, and I said, I have to go to the bathroom, and she still wasn't paying any attention to me. And so she said, well, I thought, you're not going to let me go, I'm going to get up and go find a bathroom myself. And so she gets up out of bed, or thinks she does, and goes out and tries to talk to the secretary, who also happens to ignore her, apparently. She describes the secretary who only works part-time, and that helped us place the date as well. Carol was not awake. Carol was not conscious. So she's describing this experience of, she said, well, I just decided I'm going to go out to the hall and look for a bathroom. So she goes through the doors in the hospital, the hydraulic doors, you push a button, they open. So she said, I just went out into the hallway and I wanted to say, did you open the doors or did you go through them? Because I am still thinking to myself, and you're listening to it, trying to be respectful, and she's upset, feeling like we're not meeting her needs. So you're trying to find an angle to help her understand that this might not have been a physical experience, but an experience of consciousness. So when I talked to her about it, she just, again, she could not compute. You know, her point of view, the language she spoke of physical matter reality and nothing else would not even allow her to conceive that this was a possibility. So, you know, we apologized for not meeting her needs. Because what else could we do? You know, she was not being convinced. And so the respectful thing to do was to say, I'm so sorry that you had that experience of us not meeting your needs. But I thought that was really interesting. You know, adding to my vocabulary of this spectrum of consciousness experience, I had to kind of tuck into the list of, we recognize it as something unusual, an experience of consciousness, but the person experiencing it doesn't. To them, it's impossible. So I'll leave it there, and we'll pick up after you've had some nourishment. Over the break, somebody was asking me about my name, so I'll just kind of solve the mystery. It's made up. So, Bellg is, it's just like Belgium without the My husband's grandfather came from Italy under very suspicious circumstances and did not speak English well enough to make up something beautiful. So, now I have a last name that sounds like a verb. So, an unfortunate human habit that we all have is we want to make sense of things. And if things don't really fit neatly into our understanding of the world as we know it, it becomes very uncomfortable for us. Particularly in left brain industry, where we are used to and actually educated to practice our profession based on evidence and based on things that we know are true and provable. And we have come to a collective agreement, particularly as a medical profession, where the consensus is that to do anything else is essentially voodoo. So it's in that environment to propose that there is a truth beyond what we can prove often meets obstacles. But the medical profession is not the only place that patients who have these experiences meet obstacles. Helen is a trauma patient who came to us after a very severe accident. She was trapped in her car, had to be extricated. It took them a long time to get her out. She had broken both of her ankles, so she couldn't walk. But Helen was able to get out of the car and move around the accident scene out of a motivation of wanting to make sure that the other people in the scene, in the accident, was okay. That was her motivation. So she reports that she got out of the car, walked around, checked on the other two cars that had been involved, and turned, when she heard the ambulance coming, heard the sirens, she thought, I should go back to my own vehicle so that they can properly take care of us all. And then she turned to go to her vehicle and saw herself in the vehicle. And she had this thought of, oh, if I'm there, but I think that I'm here, then what is this? And so whenever she was conscious and able to talk about it, she was talking about it. She said, you guys will never believe what happened to me, and she's telling everybody who will listen. And her kids are upset about it. Her kids are upset. She had a daughter and a son, and they wanted me to tell Helen that it was a hallucination, or that it didn't really happen. And what I wanted to say, I didn't. What I wanted to say is, if you want me to tell her that something happened where she got out and walked around the car, except she was in the car, then I'm not the right person to tell her that, because I believe that she actually did. But they couldn't see that. They couldn't accept it. And the more we talked, the more I saw that there was fear behind their concern. They thought their mom had lost it. They thought something had happened that had caused her to have some mental instability. And so their need to have an explanation and have a medical professional tell her that what she had experienced was impossible was their own attempt to soothe their fears that something was very wrong with their mother. And so what we were able to do is to reassure them that, you know, she's talking sanely in every other way. This is her truth. We can't prove that what she experienced did not happen. She cannot prove to us that it did happen. So we all have to make a decision that we're going to honor her truth. And if her truth means that she can heal better and heal more completely, then I think we need to let her have that truth. And they were okay with that. I think once we were able to reassure them that their mother was not mentally damaged, they could let her have her truth. They still didn't believe it, but they could let her believe it and not try to discount it. So we're in an environment now in medicine where we value truth-telling. We value reproducibility of what we perceive to be truth. But yet patients' experiences don't always neatly comply to what we perceive to be truth. So moving forward, it would be helpful for us as a medical profession to be able to expand the boundary of patient experience to say, I have no idea what happened to you. I can't prove it, but I don't need to. I want you to know that I believe you and that's your truth. And let that be a part of good patient care. Sandy was another patient who had been in a motor vehicle accident. She was on a road that was wet, rainy. It was a rural road. It wasn't well traveled. And some deer ran out in front of her, and she hit the deer, flipped her vehicle, and I'm not exactly sure how this happened, but she ended up in a bush. Almost like she'd been gently laid in a bush. It didn't really make sense at the scene, based on what the paramedics were saying, like looking at the vehicle, how with an accordion crush of the roof, and she was like laying in a bush. That was the first strange part of her experience, of how she got there and how she was just laying there. And Sandy doesn't remember. But what she does remember is her mother coming to her. Her mother, who had been deceased for several years, coming to her, not saying anything, staying at a distance, didn't touch her. She talked to her, she cried, but her mother didn't respond. She was just a presence. And when the paramedics came and put her in the ambulance, she just watched. The doors closed, and that was the last time she saw the face of her mother. So whenever she woke up and she was telling us about this, her son said, "Knock it off, Grandma's dead." And that was the reception that she got from someone who loved her. To tell with 2 simple sentences to try to shut her down. And he was pretty irate. Whenever she would try to talk about it, he said, "You don't understand." She said, "It was real. I saw my mom." "No, you didn't." "Yes, I did." And they had this ongoing back and forth. And there was a moment whenever I had an opportunity to talk to her son outside of the room. And I said, "It seems like it's upsetting to you to hear your mother talk about this experience." And he said, "Yeah, because it's not real." And I said, "Well, it's real to her. This is something that she really believed happened, and not only can we not tell her, we're not in a position to tell her that it didn't happen, we don't have the capacity to tell her that it didn't happen." And I said, what is your biggest concern about her having this experience and vocalizing it? And in talking, again, he was concerned that his mother was crazy. It was fear. He felt so adamant about that the way to soothe his fear was to shut down her experience. And it took a while, because his anger was pretty intense about this, and he felt that we were failing her by nurturing a delusion in his viewpoint, that we were telling her something, feeding her ego, feeding her imagination. After what seemed like a long time, it may not have been as long as it felt, because it was a very uncomfortable conversation. He was not entirely friendly. But after several minutes, we got to a point where we were able to agree that, well, I said to him, I said, "What's the most important thing?" "That she get better. That's the most important thing." And that's what we all want. We all want the same thing. We want for your mom to get better. What if part of her getting better is being able to tell her truth? To share something that she believes happened. And I said, "Listen, if it really happened or if it was a dream, it doesn't really matter. She believes it. It doesn't matter." And what if her being able to tell that story is part of her getting better? Then we all get what we want. And you get your mom. I said, but continuing to shut her down like that is opening up the door for a rift, because she clearly believes it happened. You clearly believe it don't. It didn't happen. And here's an opportunity for choice making. And how you go forward in terms of your relationship to your mother really matters. Because I don't think her viewpoint's going to change about this experience, but you can change your viewpoint of how you support your mother and her truth. And it took a long time to get to that point, but I think it was a conversation worth having, because they were able to go forward together, and she was able to talk about her experience, and he would twitch, but he wasn't angry. Not like he was. So that is really something that has become central to what I hope to accomplish in the medical field with near-death experiences is to understand that it is a central truth that belongs to the person who experienced it, and it is not our role to tell them it didn't happen, and that it can be potentially harmful to tell them that it didn't happen. There is let me come back to this. I forgot about this one. This was a great story. But how we move forward on this and how we talk about it with patients, I think there is an opportunity for education. So that said, I want to tell you a story about Laurin. So Laurin is, okay, let me set it up this way. When you speak a language, when you're first learning to speak a language, you learn just some rudimentary elements of that language. And the more you become competent in that language, the more you can pick up on subtleties. And then the more competent you become in the language, even if you hear a new word and you don't know what it means, you can deduce the meaning of the word by the words that are around it. And that's how I think that I've arrived over the past 20 years, is that there's a certain language of this spectrum of anomalous experiences that patients share with us that I think is a language to be learned. Now, Laurin, I saw in a follow-up after the ICU, and sometimes we will do that in the office after their ICU stay, just to make sure everything's going okay, see how they help them process the experience, if they had any concerns. And after we had tidied up the visit, Laurin said to me, "Can I tell you something a little unusual?" And I said, "Always." Yeah, so he said, "It's a little bit crazy." I said, I'm okay with that. Let's have it. So he was a man who was working with the diagnosis of cancer. But the interesting thing is that he told me a story of waking up one morning, and before he even opened his eyes, you know, like when you're conscious and you're aware of yourself in space, but you can't visually see anything. So he was awake, still had his eyes closed, and he said he saw this image. And it was an image of a roundish thing with a pipe going through it that was pulsatile. And he had no idea what it was. And so he woke up and drew it. And he closed his eyes, wondering if after he drew it, he would see it again, and it was still there in some form. And he focused on it, trying to see it better. And he said, and then it started talking to him. And I can see now why he wanted to make sure that I was okay with hearing something a little unusual. But he said, it said, "Laurin, I'm your cancer. What are you going to do about it?" And he wasn't necessarily on a metaphysical, spiritual path that would have helped him make sense of this vision that he had. But he took the image to his doctor and he said, "I think I have cancer, I'd like to have a chest x-ray." So the doctor got him a chest x-ray, and there was a mass in this area of his lung. And when they got a CAT scan and were able to visualize it better, it was wrapped around the pulmonary artery. And very much like what he had seen. And so when he went to meet with the cancer doctor, he showed the cancer doctor the picture, and it looked very much like, very similar, eerily similar to what was on the CAT scan. And I actually know I'm in the same medical system I've been in since I first started my work life, and so I know this doctor, and he's crazy in all the right ways. He's a very smart man, and he's a little eccentric, and I thought, perfect. So even though he might not have had the belief system that would embrace that, he allowed Laurin to tell his story. He allowed Laurin to have his truth, and then they had a little game, like, okay, draw it this time. We're getting ready to get your CAT scan. What do you think it looks like? And so he would draw it, and he would be remarkably on point. But the interesting thing to me, as I heard Laurin's story, is that he had some of the same, this experience left him with some of the same hallmarks of a classic near-death experience. Loss of fear of death, a sense of altruism, a sense of connection with something in the spiritual realm. I mean, some of the classic signs. And so I began to wonder about Laurin's experience and wondered if it was a slow near-death experience. And he eventually died, but the The cancer that he had, and this is really interesting, was a large cell cancer, and those are very rapidly growing and quickly fatal. And it's not unusual from the time that it's diagnosed to maybe 3, 6, 8 weeks later, they're gone. 2.5 years, he talked to this cancer. He would see it smaller. He would interact with it. And he had this idea, he said, you know what, I think cancer is its own species that comes here to teach us something. Like, you may be right, I don't know. But it was that sense of, there's something here for me to learn from this, became very intriguing to me. And so I started wondering, is this really a spectrum? You have the fast, quick over, quick back, life changed, and you also have this slow walk with death. He was near death. He walked near death for 2.5 years and had this amazing transformation. So I think there are lots of different ways to think about this crazy experience of being human and having this non-human side to us, this consciousness that is capable of experiencing things and informing us and teaching us if we're willing to listen. And so that's a big part of what I'm interested in doing, is changing medical culture. And I think that, when I think about the medical culture I work in, I get it. You have a very finite period of time. You have 4 years to try to create a body mechanic, because that's what we are. You have 4 finite years, and you have a lot of information to cram into that 4 years. And there's a lot of critique about how medical education could be better as far as a broader spiritual, psychosocial training, and I do not disagree with that at all. But I understand how we've gotten to this point. And then you graduate medical school, and you have a very finite period of time to become responsible in your profession. And you have, you've taken an oath to do that, and to do it well. So we're kind of left on our own once we get out into practice to try to make sense of all these things that we encounter that don't fit neatly into our medical understanding. So I think, I had a neat opportunity to work with Roberta Moore. Some of you may know her. She's a filmmaker and is very involved with the near-death studies, the near-death societies. And she approached me with this idea of making an educational film for healthcare providers with a manual, like how to talk to people about near-death experiences. And I thought, that's cool. Yeah, so I don't know that we I don't know what kind of reception we'll get, but I think that that's a really interesting way to approach how to gently broaden the acceptance in the medical field. So that is available and slowly making its way around, and that feels good. It feels good to be contributing to medicine in that way. 3 years ago, it had never occurred to me to write a book about near-death experiences, because that's been done, and it's been done to death, or to near death. So, to offer another compilation of accounts of near-death experience did not seem interesting to me, because someone had said to me, yeah, you should write these down and publish them. It's like, why? That was of no interest to me. But when it became interesting to me is whenever I started encountering some of my colleagues' attitudes of that didn't happen, and feeling that they had a responsibility as a good healthcare provider to tell them that it didn't happen. And I thought that that was messed up. So whenever I felt like I had something to contribute to the conversation, that's when I thought, I need to write a book. That's not just a list of people's experiences, but it serves to educate how to talk to people about it. And that seemed like something I had to do or my soul would rot. It got to that point where I thought, I have to do this. But it's the kind of book that whenever I wrote it, I gently floated it to the world and hoped that nobody I knew would read it. Especially the people I worked with. Because the medical environment is not entirely safe to talk about things like this if you want to be considered credible. But where I work, I knew that I had, been there for 16 years. I have good relationships, and I knew that if they wanted somebody to run the ventilator, they had to consult me. So I felt pretty secure. But I had an interesting experience. The response to it was really interesting. There were the people in my group that I partner with never said a word. Didn't refer to it. Nothing. And the people, nurses, chaplains, people who are in these that are a little bit more open to the spiritual side of patients, were appreciative. And then there were some of my colleagues who read it just out of curiosity and would not look me in the eye and just say, that was interesting. But I still have my job. I still have good relationships with the doctors and nurses that I work with. But I had an interesting experience where there's a surgeon that we all work with, and we're all scared to death of him. He just has that aura, that countenance, like, don't talk to me unless I talk to you. I will tell you if I need something from you. And so he just has a presence, and he's kind of gruff and has an edge, and you can't, no matter how self-confident and self-possessed you are, you can't help but be a little intimidated. We've all met people like that. They have the vibe. So in my little cubby in the intensive care unit where I have my little computer and I'm documenting things and looking up things, the doctors, the surgeons and cardiologists who need to consult me for critical care, they know where that cubby is. It is a cubby. It's not even an office. It's, has the office dividers. It's an area that's been set aside. So this doctor came up to me and I just assumed that he said, I just had this patient I just did open heart surgery and I need you to run the ventilator and manage all the medications. That's what I thought was going to happen. But he just stood there looking at me to the point that I became very ill at ease. And then he looked around to make sure that nobody was looking. And he leaned in, and he's very tall, and he said, I read your book. And I didn't know what to say, because you usually don't say anything to this doctor. And I said, oh yeah? And then he said, it's true. He said, what you say is true. And he went on to share with me how he drowned when he was 14. Went to the bottom of the lake, saw the lake, and was visited at the bottom of the lake with a loving, luminous being that said, it is not your time to die. You have great work to do. And he said, you're also right that it is not safe to talk about this, and I applaud you. And he said that he made a distinct decision. He shared that experience with a couple of friends. They laughed at him when he was, teenagers. We've all been there. We all have them. We all know what they're like. They laughed at him and shut him down. And so from that moment on, he said, when my teenage friends laughed at me, I never told another soul. And he said, I was curious. He said, I got to medical school, and he said, I was sure they were going to talk about it. And they didn't. He said, I thought I was going to discover in medical school the great truth of what happened to me. And he said, and then I went into surgery thinking that, he was kind of thinking what I thought. I kind of arrived at this a lot later than he did, but, working in a profession where you have people at that razor edge of death, that kind of increases the opportunity that you're going to encounter people who have experiences. He was intentional in choosing cardiothoracic surgery, thinking that he would have some answers. Like this, I didn't know what to say. I mean, I was honored. I was sad that had been his experience, and that all of this time in medicine and being a cardiothoracic surgeon, it still hadn't given him the answers he sought. And I still am intimidated by him. I can't help it. I mean, it's just who he is. But I understand. I have this amazing respect and understanding now for him, and for sharing that with me, and for validating that this is important work, to talking about near-death experiences and other anomalies of consciousness safe for the patient. And there is safe space. I think bedside nurses who are there for the bulk of their shift are presumed safe space. I mean, nurses will hear things that we as physicians never hear. Chaplains. When I was deciding to go ahead and orchestrate this book and put it together, I interviewed several nurses and chaplains that I trusted and that I had really good relationships with. And I asked the chaplains, I said, do you ever have patients tell you about near-death experiences? They're like, all the time. Yeah, white light experiences, luminous beings, seeing loved ones, not seeing anything except their body and the environment and then going back in. And I said, why do you think you hear it and we don't? And they said, we're safe. You know, we speak the language. We speak the vague language of spirit that doesn't always have a ready explanation. And so of the 4 chaplains, all 4 of them had had patients in the hospital tell them about near-death and out-of-body experiences. The nurses I talked to, they were kind of excited. They said, oh yeah, we hear some great stuff. We hear some really interesting things. Like one nurse said, with these open heart patients, I always look up to the corner of the room and wave. They, especially seasoned nurses in these intense areas will hear accounts. So then there are presumed, these professions are presumed safe space. What can we do to make every profession in medicine safe space? So we let them know that it's okay to talk to us about this. And I think that, just starting with the unusual question, that's safe for everybody. It's safe for the patient, it's safe for the physician who's interested in asking it, and something that I've tried to propagate around the hospital, now that I know I'm not going to be fired for this, have become pretty emboldened to talk about it. And the neat thing that's happened from that is I will get calls from patients from nurses who have patients I'm not even involved with. Just 2 weeks ago, a nurse called me and said, hey, this guy, he said he died, and he saw everything, and then he saw an angel, talked to his mom, came back, and could you drop by and talk to him about it? Absolutely. Yes. When I finish my rounds, I will come talk to him. And I did, and it was really interesting and rewarding. And I thought, yeah, the nurse called me. That's awesome. And I felt like I'd really accomplished something in my own little world. And that they would think of that, to call me and to know I wouldn't shut them down, and that I was interested and I wanted to hear. And just on Thursday, so this happens, when you start to, just like buying a red car, once you buy a red car, every car you see is red. You name your child Kara, and all of a sudden the world is just filled with Karas. Something about, focusing on that and bringing your attention to something. But now that my attention is there, I swear I see anomaly all around me. And I had a patient this past Thursday that not doing well. And the wife is, when I drop by to see the patient for the day, the wife is standing at the bedside, and she's tearful. And I said, what's going on? And she said, he's talking to his sister. And I said, tell me more. And she said, well, his sister died 18 years ago, and he's talking to her now. And I said, well, what does that mean to you? She said, I think he's going to die. And I said, maybe. I said, it's not looking good. But I said, what does it mean to you that how do you feel about him talking to his sister? Does that make you feel sad? Do you feel reassured? And she said, oh no, I'm happy that he's going to see her because they were very close. And then you hear, he actually says in the middle of our conversation, what? You can't eat there? And then he never said anything else. But it was funny, and she laughed, the wife laughed. And she said that sounds like a conversation they would have. But I thought, I'm so glad that I was there for that moment. I was so glad that I was there for her, for him, and for myself. the selfish part of me just wants more, and that wants to not just crusade to make this a safe part of medical language and practice, because I do believe it's good patient care, but to further my own curiosity about what all this is and what it's for. And over the break, someone asked me how this has impacted, if this has impacted my own journey. Like, yeah, how can it not? It all started with Samuel and just this intense disease that he had died because I couldn't explain to him that he was safe. And it all circles back to Samuel. So many things. Even though he died, I feel that he is one of my greatest teachers. And I think that intense discomfort I had of not being able to explain something to him, if I had been able to say to Samuel, I understand this was frightening, it happens to other people, chances are it won't happen again, but if it does, it's not, this is what it was. But because I couldn't, fear informed his choices. And so I hope that moving forward, we can propagate this culture of being able to accept things that are a little bit beyond our physical vision. So I think I'll leave it there and give you opportunities to ask questions if you like, because that tends to generate some more stories and some more conversation. Yes. Okay, you have a question.
The question is, when you have
you didn't want me to bring the mic into the audience, right?
I can do it, but normally don't.
You can, but nobody else can.
Okay, but okay. I got rights, squatters' rights. When you were talking about the boy who was afraid, and the people who were afraid that their mother was deranged in some way, my first reaction when somebody says something like that to me is to say, look, there's new information that this country has not been slow to accept. Other countries are not so slow to accept, but here this happens commonly, and it's information you need to educate yourself about. And I go from there in that way. Have you done that? Or?
That's, my approach is a little different. I always try to, especially in that what I consider sacred space, where I have a very honored place at the table when someone's very sick. You're in a place that's very vulnerable and intimate with this family. So I'm hesitant to tell them they need to do something. I hesitate to say anything more than just to, because I don't know. I mean, yeah, we do have some very tantalizing evidence, and consciousness is a hot field of study right now, but that's not my area of expertise. But what I am an expert in is honoring someone's truth. And so that's what I tell them, is to say, we don't know what's happening, but I've heard it before. And, we do have patients who will have these experiences with seeing dead loved ones and crossing into a space that we can't see that seems very happy and full of love, and then they come back and tell us about it. So that's usually how I steer the conversation. But see, it does generate more stories, so I'll tell you one. We have a cardiologist from Finland, and she is, she's very practical. She's a good cardiologist, and in her country, she was an expert in hypertension. And so when she was talking about the book, she said, oh, in Finland, we hear about that all the time, particularly our cardiothoracic patients. And she said, that's part of our intake. When somebody's getting ready for open heart surgery, we usually tell them, now, you may have something really unusual happen during surgery, but you're safe. You may have this feeling that you're floating up above your body, and you may actually see the surgery. Some people do have some visual impressions of it. You may even have this sensation that you're seeing and communicating with loved ones that have crossed over, or heavenly beings. But it's okay. It's safe. So just don't be alarmed by that. And she said that's just part of our pre-op, post-op, and peri-op care. Like, wow, we are, I just thought it was amazing. She said, we don't have chaplains. She said, it's a very Yeah, she said, we are very easy, can conceive, we can conceive that you are more than just protoplasm. That there is a consciousness to you that's capable of things that your physical self is not necessarily capable of. And I thought that was astonishing. And also coming out of Scandinavia right now is an emphasis on post-traumatic stress in the intensive care patient and how to combat that. And so there are manuals and diaries that they use to, if something major happens in a patient's care, they'll write it in the diary, put the date and the time. And they encourage family members to do that. Because sometimes we misinterpret as sick patients the things that are happening to us. And a very uncomfortable one that we have to remind patients that we were inserting a Foley into their bladder. They were not sexually assaulted. So in duress, you can misinterpret with the right setting. I mean, that's very rare, but it has happened, particularly if they have a history of sexual assault. So to be able to write that down and say, at this time we changed your Foley, you had a Foley put into your bladder. And in that actually, if you give them an opportunity to talk about stressful events or memories they have in the ICU, it dramatically decreases their risk, just like with war veterans, of developing post-traumatic stress disorder. Because the sooner that you can address it, talk about it, and diffuse it before it becomes laid down and buried, the better. So I actually brought up to our staff, what would it be like if we actually put in that diary, had a space to talk about potential experiences of consciousness, to have a version of the unusual question in that document. So that's something we're talking about now, and so that's how we talk about it. That's how we, in our institution.
I understand that it's evolving.
Yeah, it is.
The idea is to educate. Education is really important.
It's evolving and we're evolving. And right now we don't have the brain capacity or the science to explain it, but maybe millennia from now we will, and it'll all make perfect sense. Yes?
Yeah, so I have a question. So I'm a physician as well, and I do integrative medicine and psychiatry for all ages. And one of the areas that I always find myself questioning a little about, and I was wondering if you could give me some insights on this, is, so I work with people who are called psychotic, right? But I look at it in different ways,
Sure.
being an integrative physician and psychiatrist. And I have had a few young men recently who are transforming and changing biochemically, and they're doing a lot of holistic things. But they have parts that are experiencing really negative voices, sort of negative experiences of, parts outside themselves. So they would be like hearing voices. And so then I'm like sitting here going, well, maybe they have a really negative critical part inside, and they're experiencing it in a negative way, because we always hear about the positive light experiences and the love experiences. So I was wondering if you could comment a little bit of what you think of the negative experiences and the darker experiences, because then I notice the moms are getting a little freaked out, and I'm trying to keep a really open mind. So I was wondering if you've seen the darker aspects and how you look at that in the consciousness.
I'll be happy to speak to that. Did everyone hear her question? So the speaking to negative experiences, and I don't know, but I will share you my thoughts because I think a lot about this. So I have one patient who was also telling everybody about her experience, and it was very negative and very scary. She traveled down a dark tunnel. She had talking heads all around her, grotesque images. And then she got to the end of the tunnel, and she could see this small pinpoint of light at the end. And she said, I just felt like if I couldn't stay in this space, but I felt like if I could just focus on that, I would either go there or go back. That was her interpretation of what had happened. And so we talked to her about it. And, I don't pretend to, I would never interpret somebody's experience because I just don't know. None of us are qualified to say, hey, you know what happened to you? This is what it means. Yeah, we can't do that because it's their experience, not ours. And I think even with the negatives, it's that same way. So this is how I came to think about that, and how I personally think about what you described, is that, we are a complex mix of the physical and the spiritual and the consciousness. And I think that when I talked to this patient, she had had a very troubled life. A lot of darkness, a lot of despair, a lot of anxiety. And I wonder if our physical experiences kind of imprint, it's a lens. I mean, just like a cultural lens, we can all see the same thing, interpret it different ways based on the vocabulary that we speak. And I wonder if people who have some physical and psychiatric filters that are pretty dense experience it in a certain way, or if it's something totally different that's a part of their consciousness makeup. I just really don't know, but it is something that I've given a lot of thought to, and something that I think we should be very cautious in interpreting, both the positive and the negative, too. But just one more thing, and then I'll go to some more questions. When this lady actually, it still had an impact on her, this negative experience, and it actually still had a positive outcome, because she said, if I create my own reality when I die, I'm going to change this reality because that was not good. So it's still, I mean, it still had the impact of having some of the positive outcomes of a near-death experience. Did that make sense?
Oh, yeah.
Are you familiar with Barbara Romer's book?
No.
Dr. Barbara Romer, she wrote a book called Blessings in Disguise. She's now deceased, but the book is available. It's no longer in print, but it's available. Wonderful book about negative near-death experiences.
Sure.
And ultimately comes to the conclusion that they're all blessings and that everyone has the experience that they need.
I kind of believe that. Yeah, that.
What was the
You're the only one who gets the microphone.
The book is called Blessings in Disguise by Dr. Barbara Romer. She was a Florida physician who ran a support group down there near Miami. She's now passed, but she documented many negative experiences. And she came to the conclusion that negative experiences, all experiences were blessings in disguise, particularly the negative ones. And that everybody has exactly the experience they need. That's been my observation too. It's just astounding how it's exactly what each person needs.
I'm going to try to go in order because there was, yes, I'm sorry, I forgot your name.
Oh, my name is Shirley.
Shirley.
You know, do you think in regard to the dark side? I've been in critical care, but I did psych at Northwestern. I'm in agreement with the both of you. The reason why is this. We saw some things happen on 911 that never ever happened before. We had a lot of people telling their family members, young people, I'm going to die soon. In fact, there's a lady who was interviewed on the shoreline of Connecticut. These are very reliable people. She's very concerned about her husband from a psychiatric point of view. He went there, he died that day. There were other people where physically they felt something was off, they didn't go, but I'm going to give you one of my own experiences. The past year, I've been in New York City 3 times. The last 2 times, I just got bad vibes from the place, and I left both times 2 days before they had terrorist attacks. There's something we cannot explain about the human body.
I think there's a lot we can't explain about existence. And I think that you're right. I mean, I think that there is information all around us. It's how adept are we at paying attention to that information. But Neil deGrasse Tyson has one of my favorite quotes of all time. The universe is queerer than we know and queerer than we can know. And I think that, that's why I kind of resist the urge to overinterpret things, but just acknowledge it, especially in my profession. My sentinel question is, what does that mean to you, the experience that you had? Yes?
So, I've actually been hospitalized and had psychosis experience and had light and dark experience, and also have a lot of do energy work and have a lot of psychic type experiences, and I also have a sister who's very sensitive, kind of runs in our family. So that's one of my interests. I have a trauma background too, and sexual abuse, and from a very young age, and I think that opened me up when I was very young to both, but then also in my body has carries the memories. That's the way I interpret it. And then the other part I wanted to say, as far as the medical profession, because I've had a history of a lot of physical illnesses. So trauma and physical illnesses that gets held in your body, or Samuel, if he had a traumatic experience with his stomach, and then he held that fear in his stomach, and it ended up leading to death. I guess my thing is I've done a lot of work with mental health and having complex trauma, working through that, and you can talk about these things with your therapist, psychiatrists not as much, but therapists, and they honor your truth. So I think our health system does have a system in place for people to work through these things, and that's advancing too, like the mental health system, but trying to bridge mental health and physical health, because really it's just health. And it's an arbitrary, different separation that was created in the past, and it hasn't bridged enough. So I know there are doctors, certain medical systems are including more therapists. So when you're going through a physical illness, you also have a therapist working as a team with the doctor, with everyone, to help the psyche, because that's what we're kind of talking about. Two other books that were really helpful me in my recovery after the psychosis to try to understand what I've gone through. One was A Stormy Search for Self by Stanislav Grof, and he did work with people who have gone through spiritual awakenings, spiritual emergence it's called, or spiritual emergency, and I had all the signs of a spiritual emergency. So if you're meditating a lot, doing yoga, things like that, you can have an opening, which has been happening for millennia, but we've forgotten those things and got disconnected from ourselves and nature. And then also The Hero with 1,000 Faces by Joseph Campbell is another really good reference. It talks about archetypes and energy, so you can see how this is played out. It's not something new. We're not discovering something new. It's something we forgot, and we're remembering is what's going on. So that's my point.
That's an important point to remember, that something happened about 250, 300 years ago, the Age of Enlightenment. And before that, before that, medicine was actually a back alley art with incantations and potions. And I kind of understand how medicine has arrived where it has, because it struggled uphill against social gravity for about 200, 300 years to try to make it used to be a very unrespected and unrespectable profession. But I can understand where we've gotten to, but I think it's a forgetting that's happened over a very short period of time. Because if you read, this left brain Western world, and we have a Western world all around the globe and an Eastern world all around the globe. It's not geographic, it's a philosophy. And the Eastern philosophy is more comfortable in embracing the whole and energies, and they don't have this separation that we insist upon. So I do think that, to the points of the last three commenters, there are professions in medicine where that is part of your training. The psychosocial, spiritual well-being of a person, psychiatry, psychology, nursing. One of my critical care nurses actually brought her textbook in from school, from a Western school. And there's this whole page in her textbook on how to work with patients who have near-death experiences and out-of-body experiences. Oh, shut up. In a textbook, that's awesome. It's just one page, and the book was about this thick. But she actually brought that book in to show me. So that is it's part of their training. So I think there is certainly a movement. We actually have we have a team in our institution that does healing touch, and that's more and more common. And so I think we are kind of, after being, shutting ourselves down for the past, 200 to 300 years, I think there is an opening, because I think there's a desire for it. There's a desire to understand, and it's ultimately satisfying. It's ultimately very unsatisfying to work so hard to try to explain everything. it's exhausting because we can't. So then we have to kind of move into a different space of being comfortable with things that we can't explain, and at the same time acknowledge that they're real. Yes?
Have any of these patients felt a sense of immortality or past life remembrances or a connection with the relatives, some kind of a link overall?
Did everyone hear his question? So I'll repeat it. Of people who have near-death experiences, are they having past life memories? Are they having a sense of immortality and a sense of connection with others over time? Did I understand that correctly? I have not had anyone talk to me about reincarnation as a part of their near-death experience, but that may be because I'm not asking the right question, not because they haven't experienced it. I certainly think it's all possible. I mean, that's the conclusion I've come to, is that it's all possible. And I actually try to step back from over-categorizing what a near-death experience is or should be, because I think that that's just such an unfortunate human habit, to try to categorize and organize and define and to say, well, I'm sorry, that wasn't a near-death experience what you had, because it doesn't fit the 5 criteria. And I've actually heard that said, and heard people argue about it. And I thought, that is really, wow, that's ridiculous. And it doesn't serve an agenda of love and inclusion to say, you had an amazing experience, tell me about it, and what did it mean to you? How did it transform you? But I do think that by and large, you talked about, the doctor in the back talked about the psychosis and the negative experiences. By and large, and it may be the population I work with versus the population that she works with, I don't know the answer to that, but by and large, most of the patients that I interact with report positive experiences. In 16 years, I've had 2 patients report negative experiences. And again, I'm having to ask myself, is that because of how I ask the question? Am I influencing this too, to some extent? I don't know. But I think by and large, you do get a sense of immortality. The loss of fear of death seems to be a big part of it. There is a sense that they are they're less than happy that they didn't get to stay there. Some people are pretty angry that we resuscitated them and brought them back. I've actually had that. It's like, what in the hell did you do that for? I was perfectly happy there. The majority of experiences that I've encountered by asking the unusual question are positive.
I just want to ask you a very personal question about your own life. Have you had someone close to you in your family that's passed over?
Me?
Yes.
That they died?
Yes.
Oh, sure.
Okay, and I want to find out, were you able to communicate? Have you had any communications with them?
No, but my daughter has.
Okay.
I have not personally. I would love to have that gift, but I just don't. And I think we all could develop it, but I feel like I have a different mission here. Yes, sir.
I heard some reference with one of the comments that people around those who are going through let's say a transition, an illness, also have kind of weird experiences, like certain things or you feel certain things. My sister passed away about 2 years ago. We were very close, and she died of cancer. And I do readings, occasionally. So I did a reading for her, and she was in the hospital, and my daughter was in the room. She's like me, so. And I used some angel cards, and I said, let's just pull a card to see how this is all going to turn out. And we went through a whole big ceremony just with the big one card. And as she held the card, and when we looked at it, the card was rebirth. So I knew right at that moment that she was going to pass. And my daughter did too. So we felt very uncomfortable telling her that's what this means. So he said, oh, you're gonna come out of this, you're gonna be fine, you know. So it was a very powerful moment for us and an experience for us. And so we had, you know, how did that happen? How did that card out of 50-some cards get chosen?
But do you think that that was her way of telling you she already knew?
Probably.
But that was the way to communicate that to you guys.
You know, I think that's an interesting point. So for those of you who didn't hear, he was talking about doing a reading with angel cards that left him with the knowledge that his sister was going to pass. So since Samuel, I've done a lot of exploration, just out of my own curiosity, and had some interesting things like that happen, some readings, and you know, just trying to keep my left brain at ease, you know, just try to think about it and come up with ways that are acceptable to my left brain. And one of the ways that I think about this is I think we do have knowledge. I think as conscious beings, we have knowledge. And I think there are different tools to pull that knowledge out of us, or to coalesce that knowledge, or to make it make sense, or to make it interpretable. And I think things like angel cards and spiritual tools like that, we've had them for millennia in many different iterations. Runes, chalices, Bibles, other holy texts, Quran. I mean, we all, as we organize ourselves in ways that we try to make sense of the physical with the spiritual. And so I think that my own way of thinking about things like that is I think there's information out there that makes its way to us in a lot of different ways. And it is dumbfounding. It's pretty amazing when it happens. It is, and it's a gift. And I think that for myself, my advice to myself is to hold the tools lightly and let the information come to me that I need to have instead of focusing on the tools themselves. I think you've been raising your hand for a long time.
It seems as though with your interest and your deep desire to follow the stories that people who had near-death experiences, that you're in the shadow of Elizabeth Kubler-Ross. If it feels right for you, have you considered getting a group of medical personnel who've also heard these, maybe a half hour a week, and talk about them and relate to them, maybe how to relate to the patients. Also, because they, not only the patients, but probably they need some understanding of how to relate to their family members so they won't sound crazy.
I've actually done something like that in my community. You know, I said whenever I wrote the book, I hope nobody I knew would read it. But then everybody I knew did, just out of curiosity, if nothing else. But, you know, what happened from that book, I didn't lose my job. I actually became the medical director of the ICU. And that, I thought was not, I thought it was not a coincidence. I thought that that was meant to be. And so in that role, I sometimes had the opportunity to set the tone. Not sometimes, I mean, it's my responsibility to set the tone and say, this is our culture here. This is how we interact with patients around things that they tell us that we can't explain. And have had the opportunity to talk to my fellow physicians to say, you know, one of my favorite physicians is also the biggest doubter. He said, that stuff's not real. I'm like, can you prove it? That it's not real? And he said, well, you can't prove it's real. I'm like, nope, cannot. And so I said, so we're going to have to, you know, have this happy agreement that, you know, we let them have their truth. Come on, you know, we are talking about something that we, at this point in our human evolution, do not have the science to prove or disprove. And so it's healthy for us to have an agreed upon way to talk about it when we are responsible for caring for patients. This side of the room has been pretty quiet, but there's
what you just said maybe reminded me, have you heard anything about some of these experiments they're doing where they're trying to identify where consciousness is housed? I've heard only a little about that. It seems like they're trying to, but maybe you can, I don't know.
Well, I mean, it's a hot area of interest right now. I mean, consciousness studies are, the interest in it is accelerating, and I think that can only be good for us. One of the most prominent studies that made it into the news that you may be referring to happened in the United Kingdom, where they were able to, within 3 minutes after cardiac and brain death in patients who came back, were able to document an awareness of their environment around them. See, we would say they had a near-death experience. They said that they had 3 minutes of awareness of the environment around them, but it sounded very similar. So I mean, that's a study that was from neuroscientists published in a respectable journal.
Is that the one where they placed an object under their bed and then when they came to, they said what was under your bed and a lot of them could say?
No, this is different. This is that has been done in a lot of facilities where they try to set it up. But here's the problem with that, is that, okay, every year maybe I hear about 3 or 4 near-death experiences. Some years less than that. To randomize who is actually going to be in that room, to be the one to die, to see the sneakers up on the shelf, to come back into that bed and tell us about it, is going to be impossible to design that experiment. It's an intriguing experiment unless you just outfit every single room with an object that's the test object, which is a wonderful idea, but our medical society is not ready to build those kind of hospitals or even to enter into that kind of experiment. But that would be the kind of experiment of consciousness that you would want to do, is to have something in your environment that's standardized and actually be able to have the team around them that when it happened, they were all educated to collect that data. So I think that's a wonderful experiment to do, but it's going to be hard in this world to find that. But some hospitals are trying.
Oh,
Yes, ma'am.
where do you think consciousness is? Is it somewhere in the brain or is it in your spirit?
Sure.
What do you think? What do you think?
If you want to know what I think, I don't know. I mean, consciousness, brain, spirit, for me, it's all integrated. I mean, it's hard for me to know where this ends and that begins. And I think we can, there's so many different opinions about that. In what I can tell you is that the reigning scientific opinion is that it's the brain, and when that's gone, lights out. I do not believe that. I can say with confidence that I do not believe that when the brain dies, lights are out. I've seen too much with patients. But, I'm not that sophisticated to be able to explain the difference, or even to begin to understand it. We all have ideas, and I think they're wonderful ideas, but I don't think any of us really 100% know yet.
So I had a rare opportunity to be home one morning and I put on Dr. Oz, and he had Dr. Evan Alexander on with Dr. Mary McNeil, and they told their stories. And he turned to them and he said, well, I must believe you because you're medical doctors, number one. And I thought, okay, that's a start. And then he asked Dr. Evan Alexander if there was anything he'd like to say. And he said, consciousness does not come from the mind. And I thought, now I'd heard him speak before, but I hadn't heard him quite say it in that way. And then right after that, he segued into another medical doctor who was networking, kind of like a secret society almost, with a few other medical doctors from around the world. They actually have come up with a machine that measures the intensity of the energy of the person that's their body is dead, their heart stopped beating, they have no more resonance in the brain, no more electrical impulse. They actually have these people die for up to 5 minutes, and this machine has picked up the same field and current around their body that they would have in their body if they were pumping, if their heart was pumping, mind was working. So they have documentation, and then when the person comes back, it was up to 5 minutes that they died. And when the person came back into their body, they said You know, they repeated every conversation that happened. They saw everything. And so I just went, this is so powerful. But it was it was like 3 minutes of this information that was on there because it is so new. And, you know, I'm sure he doesn't want to get into the controversy either with his peers. So I just thought that was great.
No, I have,
it's out there.
I have heard about that, and I'm not so sure it's that secret of a society, honestly. I mean, the University of Virginia, the Department of Perceptual Studies are actually actively engaged with the medical school there to do those kinds of experiments. So did everyone hear what she described? So that's very interesting, and that actually kind of speaks to your hidden object question of like, how do we study consciousness? How do we prove these things? And I think that, you know, that is a rudimentary start by measuring electrical fields when the person is in their body and then in the atmosphere around it. Or measuring it in the body and the atmosphere at the same time and see how it shifts when the person dies and then comes back. You know, you had asked me if some of the experiences that I had or if I've communicated with people who had died. You know, the only thing that I can say that ever really happens to me that I'm aware of is, you know, everybody's got something. You know, they can, you know, tell who's on the other end of the line before they pick up the phone. Before we had caller ID. But one thing that I've noticed that I still am trying to understand is that, you know, we can keep a body alive for a long time with machines. And I can tell, and there's no way to explain to you how I can tell that someone is just a body being kept alive by our machines, or if there's actually consciousness there. And the way that I equate it is just a feeling I get when I walk into a room. And I have to be careful who I say this to and how. But it's like walking into a room that's humid versus walking into a room that's arid. It's a very palpable feeling, and I walk in, and if it's arid, I'm like, this is just a body we're keeping alive. And if we remove that vent when the family's ready, they're not going to take another breath. And that's usually, that feeling has actually guided me in being able to, when we make a patient comfortable, when it's clear that we're not going to be successful in keeping them alive, and we say to the family, you know, we'll make sure your loved one's comfortable, let us know when you're ready, and we'll remove the tubes and vents that's keeping them alive. And that feeling of humidity versus non-humidity has given me a little bit of guidance to say to the family, like, I don't think it's going to be long. I don't think you're going to have to wait long. Versus, it could be a couple of days. You know, people can linger. So that's kind of speaking to your earlier question, that something that I've noticed over the years that I don't have a good explanation for.
Because working with deaf people that's about to die, it's this look. You can kind of tell they have that death rattle. You can kind of tell when they're about to.
Right, people in hospice are even in tune to more than that, physically and otherwise. So you know, I mean, people who work in hospice, they notice things, and it's just, I think if we did that every day, we would notice things too. Okay, I don't know who. Okay, all right.
I have a question.
And then you next.
Has these experiences that you're observing, and has it impacted your thinking about assisted suicide at the end of life? People that are very close to death or suffering. I'm just curious as to whether you've thought about that, or I think.
Oh, I've thought a lot about it, but not in the context of a near-death experience at all. I've thought about it in context of autonomy and choice. And that's a very controversial topic, because in medicine, we're in the healing and helping, not the killing profession. And I'm careful to say to patients that whenever we assist your loved one, when your loved one is ready for us, when you're ready for us to remove all these tubes and our medications and our technology from your patient, we don't euthanize. And I've learned to actually say that because patients' families have that unspoken question. I say we assist the dying process. Personally, I do believe in autonomy, and I would never judge anyone for making that choice, and I would understand it perfectly.
So I had a near-death experience back in '83, and one thing I've learned since then is the language to describe the consciousness, even that it exists. If it's not there, someone might not even be able to talk about it. because there's no words to describe. So I just, I really appreciate your giving a container for that, to, for people to be able to talk about it. Because without that safe space, it's not going to happen. The other thing I can echo is now I'm an energy healer, yoga teacher, and all that comes from that one, incredibly painful experience, and near death. So in such pain, I wanted to leave the body, of course, like we're talking about. So I just feel like there's really important reasons people have these experiences. They do bring back gifts, and I feel like that's happening for people.
Thank you for sharing that.
I was just wondering, what's the main reason why the hospitals don't want the hidden objects, and have they been asked to do so?
I don't know that it's that they don't want to. I mean, there's, in the day-to-day running of a hospital, there's a lot of stuff to do to meet compliance, to meet JACO requirements, to meet, there's a lot to think about, not enough time in the day to actually do it. So I don't know that it's a lack of interest. I think it's distraction with the intense busyness of meeting quality standards. So I am not involved in that work. I don't know how hospitals who actually do it. I would think they do it because there's somebody there who's interested in doing it and actually has the time.
Could you tell me a study that they've done with that, with a hidden object?
I don't know of a particular study.
There was a study done by San Antonio. It was a really big study that was done. They placed computer monitors on shelves. It was really big. I'm surprised. You might want to look into that. That's what we're talking about. Yeah. Sam Parnia. He's like a doctor.
Sam
Parnia.
Okay, I want to say it again so everyone hears. Sam Parnia. Yes. And Sam Parnia is someone who has done the study where you actually have a hidden object or an object that someone who has a near-death experience can report on and come back.
Correct. And they didn't. I think the result was that there wasn't any hits. Because it's really hard to do that study.
It's going to be hard to do a controlled randomized study with a hidden object and predict who's going to die when.
They're out of the body. They're not concerned with that. So.
But Sam Parnia speaks to that if anybody's interested.
Yeah, the conclusion was that definitely it's not an illusion. It's not something like a psychotic illusion. It's definitely something real. It's different from like a hallucination. That's the conclusion of the
I absolutely believe that it's different from a hallucination, different from a delusion, and different from delirium. Because there's a clarity that people have with near-death experiences and out-of-body experiences that you just don't have with those other states of consciousness. And this is a point where I want to reiterate that I don't want to be confused with a near-death researcher, because I'm not. The one thing that's important to me, and the thing that I champion, is honoring people's truth and educating doctors to talk to people about things like this that happen to them. So I constantly get emails with suggestions on how I might continue to do near-death research, but that's not what I do. And so I haven't lent a lot of thought to how would I design a study, because that's never really been my interest. But there are people who are intensely interested, like Sam Parnia, and we're thankful for them. I hope that when I look back on my life, if the one thing that I left on this planet was doctors feeling comfortable in talking about near-death experiences with their patients, I will feel like my life is complete. So I'm not a researcher, so I don't know about a lot of these studies that you do.
I was wondering if you could tell us where we could find the study.
Well, Sam Parnia, I think if you Googled Sam Parnia, you would find all kinds of stuff, right?
Yeah, and he's a doctor too. We're such a
Okay.
doctor too.
Okay. I'm not familiar with him, but I look forward to looking it up and learning more. Yes, sir.
That was the AWARE study. It was a large, multi-center prospective study, and it really came up with a paucity of information.
AWARE study. Is that Sam Parnia as well? Okay, so this gentleman is saying that the study was called the AWARE study, and a lot of information apparently came out of that. So
very little information came out of it.
I misspoke. Very little information came out of that. But I think that the idea is that what all of these efforts tell us is that we are curious to know more. We're curious to understand. And I actually have had the the good fortune of spending some time at the Department of Perceptual Studies in Virginia, just because I was curious and my dad lives near there. And they were very gracious to let me come in and kind of follow them around. They did some things on me with, giving me a chance to try to move a ball with my mind and stuff like that. And it's, I did not get a passing grade. But it was really fascinating to watch some of the people there who could do those things. And it really opened me. So there, that's is anybody familiar with that? The Department of Perceptual Studies at the University of Virginia? That's well respected, well funded, and they are doing consciousness experiments. So I think, they're at the edge, but, at the fringe, but at least they're part of the rug. And, they do have a lot of respect for the kind of research they do, even though many of us would consider it, well, we wouldn't, but other people would out there. Yes, ma'am.
Have you ever heard of people saying that they've seen the spirit leave the body?
I have heard that.
Could you repeat the question?
Oh, I'm sorry. She asked me if I've heard of people seeing the spirit leave the body. We're running low on time, but I will share an experience. After I released the book and some of my colleagues had read it, there was a physician's assistant, a PA in surgery, and 2 nurses who had this collective experience and couldn't wait to tell me about it, that as the patient they were resuscitating died, they didn't see anything, but they all collectively felt this rush of air that left the body. And I think it's cool that they were able to have that shared experience. I think it's even cooler that they told me. Yeah, that they felt confident to tell me that I wasn't going to think they were crazy. So I think, I've heard of that, but that's the one experience I know of people that are connected to me who have actually had that experience of being aware through the physical senses of they interpreted it the same way that I did, that was the time the spirit left the body, because that was the time that the patient flatlined. One or two more, you think, Diane?
Yeah, I've got 10,
Okay.
12 minutes.
I just want to say, I think the work you're doing is very important. I had a guy when I was 7 and was thrown back, and getting all choked up, literally. For 50 years, there were no words for my experience. And when I did find out what it was that I experienced, I had huge tears come to my eyes, and I think acknowledgement and witnessing and the words at the right time really help knit the being back together, whether they can accept it in that moment or not. I think the work you're doing is quite profound and well needed.
Thank you.
I personally believe that to tell someone you don't believe them is disrespectful and insulting, and to tell them that you believe them, even if maybe you don't, is a generous act of grace.
I also just want to say, as somebody who's done critical care, it's very important to respect the family's wishes, the patient's wishes. And you know what? I've done a lot of pediatrics, and especially when you're working with children, it's very hard for a parent to say no. And we have saved some patients we thought were just, not going to be salvageable, and they've come in with very slight disabilities. And then you have some people who are supposed to go into surgery. These are major medical centers, and they do not do well. And I can remember 2 patients, one of whom went to surgery. Another one that fire rescue team, brought in, and she was a gorgeous little gal who was in a horrible car wreck. We worked so hard to save that little girl until her parents got there, because those paramedics said she wants to live, and you know what? She's doing great.
Yeah, I don't know if you could hear her, but she was speaking to the fact that there are some patients that you expect to do well, and they spin out and die. And then there are some people that you expect to die, and against all odds, they live. And, we see that too in the adult world. and things that still just defy our ability to explain them. And you heard doctors that I work with say, I don't know, it was a miracle. You know, and to be able to actually own that. And I think that most of us realize in the helping professions that there's a limit to what we can do and a limit to what we should do. But I tell patients that too. I said, you know what? I can do all these things with my medication and my technology, but there's something I can't do, and that's how you feel going into this procedure or how you feel. I said, attitude matters. And I will say that. I said, you know what? I have patients who say they're going to die, and guess what? They die. I have patients who say they're not going to die, and guess what? They live. So that's, you know, we all have a job here, and your job is to decide, are you in? And then what resources are you going to put toward, you know, maintaining that attitude and the intention. Sorry.
Oh, don't be silly. I just one other one. I had a personal experience. Now, my wife has been gone for 3 years. Died of cancer 3 years ago this February. And she had a cat that lived in her lap. And little Zachary wouldn't go anywhere because mommy was there all the time. When my wife left for her final trip to the hospital, when she died, Zachary got very depressed. And started having all kinds of problems eating and toileting and wouldn't use the litter box and there was mess everywhere. Then he started looking really bad. So I decided to take him to the vet. And on the way there I said, Zachary, you may not be coming home. You might be going to join mommy. And there wasn't a choice. He looked terrible. And the first thought I had was, if I go and try to get this poor cat hydrated and get him blood, because he'd been bleeding too, you know, for whatever reason I never found out. And if I go and try to do this, what's the guarantee he's going to live? So I went to the vet, told him, we put him down, and I felt a tremendous sense of relief. And then I cried all the way home, went to my kitchen, and cried the rest of the day. And then I felt a blast of cold air, and a hand reached out from my shoulder as if to say, thank you for sending me Zachary. He'll be my companion forever.
That's lovely. Thank you for sharing that. So
I'm sorry.
That's and what a comfort to you.
Oh, absolutely.
I was going to ask you about miraculous healings. Have you run across many of those in your work?
Occasionally. Yeah, I think that most physicians, if they're honest with themselves, will realize that there are things that happen to the patient's benefit that we had zero to do with, and that we shouldn't take credit for it. So yeah, I mean, there have been times when my jaw dropped and I'm like, didn't see that coming, and have no explanation for it.
Yeah, so I just was thinking about, I'm from India actually originally, and have been through some light experiences as well, and you talked about other states of consciousness. I really appreciated that tied into having like the slow sort of experience that maybe not just a near death, but sort of an experience that brings people the same gifts. And so I guess I was thinking of how years ago when I went through that, my father was driving me to Madison for an experience, and he said, so where am I driving you this time? You know, because I was doing all this holistic stuff, and they're all physicians. My family's all physicians. And I used to be in this very room at Northwestern, you know, for training here. And so I said, well, you know, we're going to this place where someone's going to just extract some dark energies and sort of like bring back some parts. And he said in Hindi, Khud nikaalne hain, which means taking out the ghosts, like shamanic. And it really made me realize that even my dad, who's a conventional cardiologist, Western trained physician, you know, from India, in all the cultures we've had those different states of consciousness. And the shamans always would have near-death experiences to become the healers that they are. And often when I see people with psychosis or these other gifts, I'm wondering about what a disservice we're doing when we're not honoring their process to emerge as the healers they will be. And I think the world is ready, because I just remember even last year that movie was out, The Shaft. And I was, The Shack, thank you, The Shack, not The Shack, The Shack.
There's a difference.
That's but The Shack, you know, and I was like, at the end, they kind of left it up in the air. Of like, you know, well, what was that he had, that experience of, you know, after the accident, you know? So I feel like the world is so ready, and it's just amazing to see how it all interconnects, you know?
So ready to remember, like someone said earlier. You know, my own consciousness journey, I don't know exactly what kind of journey I was on before Samuel, but there's definitely been a trajectory since then that has my own curiosity for myself has become these states of consciousness, and have done a lot of work at the Monroe Institute. I'm not sure if anybody's familiar with that, but they spend a lot of the time research in exploring states of consciousness and how to offer participants ways to experience it through sound. And I've had some really unusual experiences with that modality, and that I think it's novel and I think it's really revolutionary, and then I will go read a Hindi text, or I'll go read something from the shamanic tradition. I'm like, oh, that's so cute how you thought that was original. It just is not. It's ancient, and part of my own journey is understanding that there is this ancient wisdom that has a lot of different manifestations all over the world, has so many similarities. We just have different vocabulary to describe it. A couple more questions?
I'm curious if you had, with dementia and communication on the other side. My mother has dementia. She sometimes asks where her mother is, but then a couple of years ago she was in observational at the hospital, and she saw her grandmother, and she had a smiling face. I was more disturbed by it than she was, because I thought maybe this was, they're coming to bring her. But do you know anything about? I mean, how do you know? Because it was not a hallucination. It didn't feel like a hallucination, even though she did have dementia.
So it sounds like there was a moment of clarity against the backdrop
I mean,
of
she
her.
really saw her grandmother.
Yeah. One thing that's interesting to me is that what I'm hearing is that what you're describing is, as people get close to death, they frequently will see loved ones and see things that we can't see. And what's interesting to me is that, and I will circle back around to that, but that physicians, if they don't believe in, if they're not ready to embrace near-death experiences, physicians widely embrace the bedside conversations that people who are dying have. And I think that is just submitting to the preponderance of evidence. We've all seen it. They see it. And even physicians that I work with who are pretty hardcore left brain I've heard them say to families, they must be getting close because they're talking to relatives that have passed over. They're talking to their dead husband. And that's very interesting to me. So I think the potential is there for that stretch. But so that in states of advanced age and dying, where approaching that veil gets thinner and thinner and thinner, it almost sounds, and please realize this is my interpretation, but against that backdrop of the physical state of dementia, there was a moment of clarity and breakthrough that we see in other patients who get that close to death. But
she's not dead, but it was just, it broke for a second. Like, she really was interacting, and she seemed happy about it.
And you know what you saw. Yeah, you know what you saw, and you know the difference between her natural state of dementia. I apologize, I misunderstood what she had passed, but no, it sounds like there was a breakthrough and that it meant something to you, and I think that's the most important thing, in my personal opinion. How are we doing?
Good to go.
Yes.
Do you feel, however, that the physicians think that the talking to the loved ones is a phenomenon of the dying brain, or proof that there is life after death?
I have no idea what physicians think, except myself. No, I actually think that there is a lore in medicine, and that is accepted, that if they're talking to dying relatives, they're close to death. I don't think that the impression I get over the past 20 years is that they actually believe it because they've seen it, and it falls in that category of, I can't quite explain this. That was a miracle, your loved one got better, I had nothing to do with it, this is great. And it falls into that category of, I've seen this so many times, I have to give it some credit, but I still am not ready to go wide.
God bless you. Thank you so much.